for joining us today for our continuing series that we call The Road to HIPAA Compliance. We are taking a different topic every month and looking at these different components that make up a good strategy for being HIPAA compliant. And if you haven't had a chance to see some of the previous webinars, please visit kirkpatrickprice.com in order to download those at your earliest convenience. Today's topic is on policies and procedures. And our firm is a licensed CPA firm that specializes in information security and regulatory compliance audits. And we are providing assurance services to over 400 clients in more than 46 states, Canada, Asia, and Europe. And our organization specializes in the frameworks such as HIPAA and HITECH, as well as ISO 27001, 27799, and NIST. And we want to give a special welcome today to our friends from the Healthcare Compliance Association. We hope everyone enjoyed the Compliance Institute last week out in Las Vegas. And as a reminder, this webinar series has been approved for 1 credit of continuing education by the Compliance Certification Board. So if you are in need of credits for continuing education, this is a good place to come every month to pick up 1 credit every time. And we have with us today Mark Heinle speaking with us, and I want to just give you a little bit of an overview of what professionals like Mark do here at Kirkpatrick Price. We focus on 2 different areas, one being regulatory compliance. Whenever someone is working on complying with a law such as HIPAA, we do provide consulting in that area, and we can look at your policies and procedures and give you recommendations and advice on that. We help organizations conduct their annual risk analysis for HIPAA compliance. We also help organizations develop their own internal audit function in order to test themselves and go through that exercise internally. And we perform readiness audits to help you understand where your gaps may be in complying with a particular law or regulation. And when it comes to information security, we provide guidance and we perform audits on such frameworks as HIPAA, SOC 2, SSAE 16, PCI, FSMA, and ISO. And one of the ways that you can get in touch with us is by following us on Twitter in order to get up-to-date information on what we're doing and current trends and issues that are out there. We also invite you to subscribe to our blog and continue to come to these webinars and also connect with us on LinkedIn. We would love to have a connection with you and share valuable content and information as things come up. Let me introduce you now to Mark Heinle and let you know a little bit about his background. Mark is one of our regulatory compliance specialists here at Kirkpatrick Price, and he also used to work with the Attorney General's office, and he's a member of the Florida Bar, and he's currently working with the Office for Civil Rights on a project having to do with Phase 2 compliance and providing valuable services there. But he's also worked in General Counsel's office for State Healthcare Oversight Agency, regulatory affairs for Medicare, Medicaid, HMO, and he's also been involved in complex healthcare litigation. He also holds a certification from the SANS organization in the law of data security and investigation. So today, Mark is going to talk to us about policies and procedures, and for any of the audits that we do, policies and procedures are always the underpinning for what it is that we're looking at. If it's not written down, it didn't happen. And one of the most common findings that you will have in one of the audits that we do is a lack of documentation or outdated documentation. And we all know this, and we all know that this is a gap in our organizations when it comes to keeping that relevant, keeping it updated, having the proper things documented, but it's very difficult to do because it takes a lot of time and energy to invest in getting that where it needs to be. So Mark is going to talk to us a little bit about some things to be aware of that we should have documented as part of our policies policies and procedures when it comes to this road to HIPAA compliance. So Mark, I'll turn it over to you.
Thank you, Joseph. I want to join Joseph in welcoming all of you to our presentation today, and I hope that the information that we provide will assist you in evaluating your own policies and procedures so that as you undergo internal audits or external third-party audits, or in the event that you're audited by the OCR, you have what you need to not only govern your practices, but to respond to requests for documentation. Before I begin, I want to provide this legal disclaimer that this presentation provided by Kirkpatrick Price is for educational and informational purposes only and does not constitute legal advice. And this presentation does not create an attorney-client relationship just by viewing it. And if you do need legal advice, we recommend and request that you please consult with your own attorney.
And Mark, let me interject. I did forget to remind everyone, if you do have questions during the presentation, be sure to click on the Q&A section of the WebEx interface there and submit your questions throughout the presentation, and we'll get those answered at the end.
Thanks for that reminder, Joseph. So let's do a quick overview to give you an idea of where we're headed for today's discussion. We're going to break our time down into 3 different areas. We're going to talk about the purpose behind policies and procedures. Joseph alluded to that and explained that a little bit. Then we're going to talk about some keys to policies and procedures. It's important to know the specific regulatory requirements that generate the need for these policies and procedures, but it's also important to know some basic concepts and basic elements to policies and procedures when you go about drafting those. And then the bulk of our discussion, our third part, will be looking at some specific issues that the OCR has already taken enforcement action against in terms of the privacy rule, security rule, breach notification, business associate oversight, and internal auditing. And I chose these examples because they are real-world examples, and they give us an insight into what the OCR is looking for and how they're interpreting requirements with respect to policies and procedures. So now that we know where we're going, let's talk about why we're doing this in the first place. As Joseph mentioned, policies and procedures are a bedrock to any evaluation of an organization's compliance. But as he also mentioned, they're difficult. Many times when people express the need for policies and procedures, there's resistance and pushback, and people would rather go to the DMV or perform minor surgery on themselves than go through the process of having to talk about and then draft and then review and then publish and then communicate on policies and procedures. So it's important to know why we're doing this, because we at Kirkpatrick Price, our goal is to do everything with excellence. And excellence is much more likely to occur when we know the why behind what we're doing. And when we don't know the why behind what we're doing, we tend to care less, and we end up having documents submitted to the OCR that still have your name here in multiple places from an out-of-the-box procedure product. So we want to know the why behind what we're doing, because we believe that will lead to policy and procedure and then operational and compliance excellence. So the first reason behind why we're doing this is because it's the law. The privacy rule, the security rule, and the breach notification rule all require policies and procedures. So that's a fairly simple and a significant enough reason to create policies and procedures. But beyond just the legal and regulatory requirements for policies and procedures, there are a couple of other benefits, 3 that we're going to specifically talk about today. The first is clarity, the second is uniformity, and the third is brevity. Creating a legible implementation of HIPAA is critical to compliance. At any organization, various employees are going to have different needs. They're going to have different knowledge bases and different expectations. And policies, and particularly procedures, turn HIPAA's complex regulatory language into slightly less complex policy and procedure jargon. So what we do when we create policies and procedures is we take the regulatory information and we provide it in a way that's understandable to our organization, both at the level of education, but also at the level of performance and services that our organizations provide. The second benefit to creating policies and procedures is to create uniformity. Policies and procedures create a greater likelihood that organizations will pursue the same goals with the same values in the same ways across the board. And uniformity is important for regulatory compliance and effective healthcare services. The third benefit to creating policies and procedures is for brevity. Unnecessarily long procedures and policies, including policies and procedures that are clear, create and uniform, still run the risk of being non-compliant, because at a certain level, people just begin to tune out documents and requirements that are unnecessarily long. No effective employee has the time to review all of the privacy rule or all of the security rule or all of the breach notification rule each time they have a question or a concern about whether certain disclosures are permitted, whether a certain incident constitutes a breach, whether a certain safeguard is or is not in place. So policies and procedures provide smaller, more direct, digestible portions of regulatory requirements. So we're doing this, we're having this discussion, and we're implementing policies and procedures because the law requires it, because it provides clarity, it provides uniformity, and finally, it provides brevity. So now that we know why we're doing this exercise and why policies and procedures are important, let's talk first about some key concepts to policies and procedures. And I want to mention 4 in particular. The first is authority, the second is creation, the third is review, and the fourth and final key concept is communication. Each organization should ensure that policies and procedures are created under and with the proper authority. And that means that's not just the authority to actually put pen to paper or finger to keyboard. There must be a clear establishment that the concepts included in a particular policy or procedure have been approved by the appropriate individuals, so that documentation for an organization actually mirrors that organization's intent. And in a little bit, we're going to talk about the definition and the idea behind a policy and a procedure, so that maybe this concept becomes a little bit more clear. So all policies and procedures must be drafted with the proper authority, so that there's no conflict, and so that documentation and actions mirror the intent of an organization. A second concept that's key to policies and procedures is to have the appropriate means of creation of new policies and procedures and amendment of existing policies and procedures. And there's 2 parts to that. The first is having a formal drafting, review, approval, and publishing process. And that process would involve checking for conflicts with existing policies and checking for compliance with legal requirements. It would involve making sure that the document covers all of the necessary items without being unnecessarily long and confusing. And then it goes through a process whereby the right people see it and approve it before it's published. And I want to make a note during the creation process that people with the appropriate access and expertise need to be involved. And sometimes the people that are appropriate to draft policies might be different than the individuals who are appropriate to draft procedures. As I mentioned, we'll talk a little bit about the difference between policies and procedures and why that might make sense. But policies generally being at a higher level and procedures involving much more specificity, it might be best to bring in some different people, some different subject matter experts to be the ones to draft policies and review them, and then those to draft procedures and review those. So you need to have the appropriate authority to draft policies and procedures. You need to have a defined formal method for creating and amending policies and procedures. You also need to have a formal review process. As Joseph mentioned, not only is it important to have policies, but it's important to make sure that they're up to date. Policies and procedures should be reviewed at least annually and whenever a regulatory or business environment change occurs that would constitute a review. This concept of reviewing policies and procedures is easy picking. Any policy or procedure in the HIPAA world that has a date stamp prior to September 23rd, 2013, when the omnibus rule went into effect, is going to catch the eye of an auditor, and it's going to lead to a question of credibility, and it most likely indicates that the document is not compliant. So it's important to create a way for you to identify the last time that your policies and procedures have been reviewed, and then to ensure that those policies and procedures, as I mentioned, are reviewed at least annually, if not more frequently, when a regulatory change or a business change occurs. The fourth and final key concept of policies and procedures is the idea of communication. Reasonably effective policies and procedures that are successfully communicated to employees are better than perfectly crafted policy and procedures that are never or imperfectly communicated to employees. So the legal requirements that create the need for policies and procedures are the same legal requirements that create the need for communication of these policies and procedures. So it's important to make sure that there's a sufficient method for employees learning about new policies or changes in policies, as well as having access to those policies on an ongoing basis. Now that we've talked about some of the key concepts to policies and procedures, let's talk about some of the key elements. And this is where people's eyes start to roll back in their head, but it's important to know, like I said, the why behind what we're doing so that we can do these things with excellence for our organization. And I'm going to go through these relatively briefly because these are fairly standard and they're a bit self-explanatory, but I want to identify them with a little bit of length. So the first key element is to have a purpose in your policies and procedures. The purpose is establishes the goal for the document. For example, a security rule policy, the purpose might be a high-level general one to protect the confidentiality, security, and integrity of PHI. But for a security rule procedure, the purpose might be to ensure that all employees receive appropriate training in order to protect the confidentiality, security, and integrity of PHI. So the purpose should set forth the overall goal for the document. The second key element is the scope. The scope sets out to what and to whom the expectations and processes apply. So is this a policy that applies to the entire organization, such as an information security policy, or is this a procedure that applies only to one business unit? Is it a policy or procedure that applies to your entire organization, or is it a policy or procedure that applies also to third parties, vendors, or business associates? The third key element is definitions. Institutional language is a significant barrier to new employees. Anytime you started a new organization, or even if you've been at one for a while, people start using acronyms, and entire conversations can occur without with sounding just like alphabet soup. So it's important in your documentation to ensure that your terms and your acronyms are defined, and doing so will increase the likelihood of your entity's ability to comply. The fourth element is the substantive content of your document. It's your policies and procedures. The next element is responsible parties. Now, this element can be something that is separate in a separate standalone section, or it's something that could be integrated into various parts of the document, depending on preference and depending on if there are multiple different individuals responsible for multiple different parts of the document. And it's just important to identify who is responsible for what actions. Because as you said, if something is assigned to everybody, then nobody will do it. So it's important in your policies and procedures to identify either in a standalone section or throughout the document who is responsible for what actions. The next key element is to establish if there's any exceptions or exemptions. Are there legal or business exclusions to the scope or to the policies or to the processes? The next key element is enforcement. And this section answers the question, what happens if this policy or this procedure is violated? So for example, if an employee unintentionally discloses PHI, that unintentional disclosure may result in a warning or even termination. The final key element is a references section. So this is where you would include any attachments or forms, or where you would refer to internal or external documents that are relevant to your policies and procedures. Now, this is a list of 8 items or 8 elements that I've identified as key to policies and procedures. Some people choose to combine them, to eliminate some, to add others. As I mentioned, the goal is to be compliant with the law and to create uniformity and clarity and brevity. And these elements have been identified as some that will assist in that process. But when you're evaluating your policies and procedures, they need to be relevant and appropriate for your organization. So it's not just something where you take this list and you copy and paste without thought. When you find your own needs, there may be additional items or key elements that are appropriate for your organization, or there may be some key elements that need to be amended in order to be appropriate. So now that we've identified some key concepts and key elements, I want to talk briefly about the differences between policies and procedures, because this is something that's frequently discussed and is a source of confusion, in part because the terms sound alike, and also people tend to use them interchangeably unintentionally. So a policy is a statement of management intent, particularly in this case to comply with an external HIPAA requirement. A procedure, on the other hand, is a process or processes designed to fulfill management intent. So at a basic level, you can think about the differences between the concept of a policy. It answers the questions of what and why, and procedures answer to some degree the questions of how and when and where and by whom. And at a basic level, there's two differences. There's a difference in purpose and a difference in the level of detail. Now, some people go into add a third category that's called work instructions or operational instructions. These are even more detailed and specific than procedures. They include kind of a step-by-step, the greatest level of specificity, and they're generally, the purpose of them and the use of them is by those in daily operational levels. But for the bulk of our consideration, we're going to talk about policies and procedures. And again, depending on the needs and preferences of your organization, some organizations like to keep policies and procedures separate. Some like to combine them. Some take a mix where policies and procedures are combined for some requirements and they're separated for others. Again, knowing the why behind what we're doing, it will enable you to make the choice that's most appropriate for your organization and your compliance efforts. So now that we've talked about some of the basics behind policies and procedures, what they are, what they should entail, and why we need them, let's get into some specifics with respect to HIPAA policies and procedures. Now, it would be impossible within a 1-hour period to cover all of the policies and procedures required by HIPAA. So I've chosen a few that have been noted by the OCR in different capacities, either in enforcement actions or in communication, as being items of importance. So we're going to go through several different HIPAA sections, and we're going to start with a privacy rule. So one of the key policies that any organization and covered entity needs to establish is a defined record set. What items constitute a patient's entire record for each entity? Because patients have the ability to access those records, and so when they request their entire record set, our organizations need to know with specificity and with clarity and with consensus what that entire record set means. And to complicate things, you have a facilities records, you have outpatient diagnostic test results, you've got physician records, you've got a patient's own personal health records, you've got pharmacy records, and then you have, on occasion, administrative and financial documents and data are mixed in with clinical data. And so you've got all these different types of records in different media and formats, and without a defined policy for establishing what constitutes your record set, you're liable for confusion and perhaps non-compliance. In addition to defining a record set, as we talked about, there's also a key element for policies and procedures is exemptions. You also need to define what records are exempted from the entire record set. So for example, a regulatory perspective, patients are not entitled to access psychotherapy notes. So it's important to define for your organization what those notes would include. It's also important to establish an escalation procedure and to identify responsible parties for when there's a dispute between your entity and a patient over whether certain records are covered by an exception or whether certain records are part of the patient's entire record set. So one key situation is to make one key policy that needs to be established is to define what your record set is. And the reason that's important is because patients can request their entire record, and they can also request a summary of your records. And so in addition to defining your record set, you need to determine and establish policies and procedures to differentiate between when patients are requesting their entire record set and then when they're requesting just a summary of their records. And the reason this comes up is that, for example, an entity provided a summary of a patient's records instead of a complete record set based on their belief that state law allowed them to do so. But the OCR said that the only reason to provide a summary of records instead of the entire record set is if the patient or the patient's representative consents to or asks for a summary of the records. So that was an enforcement action that required an entity to revise its policies and procedures to make sure that the individuals responsible for responding to these access requests knew what the defined record set was and knew when they had grounds and the basis to disclose a summary instead of the entire record set. A second important privacy rule policy that needs to be established is one that governs your accounting for disclosures. You're required by the privacy rule to document when a patient's protected health information is disclosed. And the guidance that organizations need to establish first are what constitutes a disclosure. So to make sure that entities know when they have to make an accounting. So we know that disclosures do not include information shared for treatment or payment or operational purposes, or instances that are required by law, response to a subpoena or litigation, research, or workers' compensation. So all of those different scenarios, some may be intuitive, some may be counterintuitive, and it's important for your organization to establish what constitutes a disclosure so that the people responsible for accounting for disclosures know when they have to record the information and when they don't. And when you do have something that's identified as a disclosure that requires accounting, it's important, as I said earlier, to identify the responsible party who must document the disclosure, and then what information must be documented. And that includes date and time of access, the name of the person accessing the records and their contact information if known, a description of the PHI disclosed, and a description of the purpose of the disclosure. So those are the key elements that have to be documented when a disclosure actually occurs. Additional considerations for your accounting policies: how will you document that accounting? What's the mechanism, the software, the system, the way that you will document those disclosures? And then how do patients request an accounting of the disclosures? Because not only are patients entitled to their medical records, they're also entitled to an accounting of disclosure of their medical records. So you need to have a process if there's forms, if there's responsible individuals, if there's software involved. How is it that a patient can request an accounting of the disclosures? And then how does an entity ensure that a patient only receives an accounting of the disclosures of their own PHI instead of receiving an accounting for disclosures of their own plus another patient's, or receiving another patient's accounting of disclosures? And then finally, it's important to establish an internal auditing policy to make sure that disclosures are being accounted for, that requests for accounting are being properly complied with. A third important policy to have in respect to the privacy rule is your notice of privacy practices. And this is one that's one of the most basic and well-known. So we're going to talk about a couple of specific ways in which you might need to evaluate your policies regarding your notice of privacy practices. And this is based on an incident where a mental health provider failed to provide its notice of privacy practices to the patient, or the patient was a minor, or the patient's father prior to the mental health evaluation. And the OCR said that provider needs to revise its processes to ensure that patients received the notice of privacy practices before the services were provided. Another situation that's a little bit more nuanced than just having a notice of privacy practices that's compliant is another provider conditioned the privacy rights within the notice of privacy practice on its patients signing an agreement not to disparage the provider. For example, not to go on social media and speak negatively about that provider. And the OCR said that was not appropriate, that the notice of privacy practices and the rights contained within that notice are not subject to any other agreements with the provider. So the notice of privacy practices is very detailed, is very specific down to the heading and the different key elements. So it's important to evaluate your notice of privacy practices in terms of not only content, but process and if there are any other agreements or notices that go along with that notice of privacy practices to ensure that there's no violation of the privacy rule. Another key policy for the privacy rule is authorizations for disclosure, specifically an incident involving forms. Your organization should consider whether or not what you would do when a patient brings their own form into the office or into your organization for authorizations for disclosure. An organization was subject to some sanctions because they allowed a patient to bring their own form in. It was something homemade, and it didn't cover all of the necessary items. And the OCR said you need to not only revise your practices, but you need to create your own authorization form to specify what the authorization actually covers. So what would your organization do if someone brought in their own form? Would you allow them to sign it? Would you require them to sign your own form? Would you evaluate that individual form to see whether it's compliant? Those are some considerations you need to make when you're evaluating your authorization for disclosures. So we'll do, on the next slide, we've got 4 more parts of the privacy rule that should govern our policies, and then we'll move on to the security rule. One item our privacy rule policies need to consider is confidential communication and particularly patient contact directives. So, for example, when a patient says, only contact me at this phone number, or never send mail regarding my health care to this particular address. This stems from a situation where a patient requested that a provider contact her at her work number, but the provider of the hospital called the patient's home and disclosed some information and in violation of the patient's request. So our organizations need to evaluate how we will handle patient contact directives, how we will document them, how we will ensure that those patient contact directives are communicated to the appropriate individuals, how we will evaluate whether when those patient contact directives expire or when those patient contact directives change. Another aspect of confidential communications that needs a policy consideration and process is the minimum necessary requirements when leaving a phone message. So in addition to that situation where the provider called the individual's home, they still would have had an issue with the way that they left information on the individual's answering machine. So if they'd have left a message on that individual's work number, they still would have been governed by the minimum necessary requirement. And then the third and final policy consideration that we'll talk about for confidential communication is how to control and restrict discussions within waiting rooms. So if you have patients in your waiting rooms, how do you ensure that, for example, testing procedure and testing results aren't discussed within hearing of other patients? Another key privacy rule issue that the OCR has mentioned is the aspect of fees for records. The privacy rule requires that fees be reasonable and cost-based. So at a basic level, it is impermissible to do flat fees where you charge an amount regardless of the nature and volume of the record requested. So it's important to establish how you will determine the cost and how you will ensure that the total cost to the patient is related to the effort that's put into producing those records. Another key policy consideration for the privacy rule is how to deal with record retention. So generally that's something that organizations are aware of, but there are some nuances to it. So for example, how do you ensure that your record retention policy and your procedures cover the various different forms of records and information, the various different electronic forms and the various different paper formats? How do you determine what records are active versus what records are inactive? And something that also needs to be considered is what happens with the status of record retention when a patient dies. How long will those records be kept? Who will have access to them? And all the different considerations regarding a patient's death and the nature of the impact on record retention. The final privacy rule policy that we'll talk about today deals with workers' compensation. So what happens when you're dealing with this kind of unique aspect to the privacy and restriction around disclosure of healthcare information when an employer is entitled to an employee's healthcare information when it involves a workers' compensation claim? It's important to establish a requirement that the employer actually has to request the records before disclosing PHI. So there's a situation where an entity disclosed health information to an employer without the employer's request on the basis that they believe that there was a workers' compensation claim involved. And the OCR said that the entity had to revise its policies and its procedures to ensure that workers' compensation claims and the request to view records from an employer had to occur before an entity could disclose that PHI. So now that we've talked about some important policy considerations for the privacy rule, let's talk about some security rule policies. We're going to just talk about two because we're going to talk about one a little bit more in depth. The first of those is the requirement to have a risk analysis. The requirement is to conduct an accurate and thorough assessment of potential risks and vulnerabilities of systems that create, transmit, receive, or maintain electronic PHI. And so this is an enterprise-wide evaluation. And it's a requirement that has proved difficult for many organizations. Some have copied and pasted a previous year's risk analysis over and over and over again. Others have described the process regarding their risk analysis, but they never actually demonstrated and went through the steps, at least on paper, to disclose to the OCR. So the first thing that needs to be done within your risk analysis policy is to define your electronic records environment. You've got facilities, you've got workstations, you've got mobile devices, that, providers and staff using tablets and other special devices. So you need to define what's covered by this risk analysis. And then you need to include the specific components of a risk analysis. And this seems to be the area where most entities are tripped up. This kind of risk analysis is not unique to HIPAA or healthcare. There are different variations of risk analysis standards. The most common and well-known probably is NIST. But at a basic level, you need to include a specific system description, a description of the vulnerability or threat, the likelihood that that threat would occur, the impact that would exist if the threat occurred, and the existing controls, the controls that you have in place to reduce those risks. And so it is a template that is repeatable over and over and over for your entire electronic records environment. And it's important, as I said, that this template cover all of the required elements, and then it be conducted every single year. And there may be a situation in which the risks, the nature of the risks change, the way that you'll accept or control those risks change, and so your policies need to establish the essential components of a risk analysis, and then what your organization will do in response to the outcome of risk analysis. The second part of policy consideration for the security rule that we're going to talk about is some specific administrative safeguards that your organization should have in place. As we go on to our next slide, I want to give a little bit of background about why this is important. There was a covered entity that sent data that included, it was various kinds of data, but that data included PHI to an IT vendor who was not a business associate of that covered entity. And that covered entity didn't have a policy or procedure regarding authorization or verification of sending data, including protected health information, to vendors who were not VAs. So there needs to be defined security management processes in place that establish who and when and how all data should be transmitted. But specifically data that includes PHI, should be transmitted. That those processes should include a verification policy and procedure that ensures that a party that's requesting or about to be sent data is a BA before PHI can be submitted to that organization, and who is responsible for knowing who is a BA and who is not a BA, and who is responsible for giving approval and for documenting that approval. Additionally, it's important to have, as we talked about earlier, training on those security management procedures and policies so that the people who are responsible for transmitting data know the verification steps and the verification authority that's required before they can submit data to an outside party. So for the security rule, two important things to consider. The most common is a policy and procedures regarding your risk analysis, and then you're creating administrative safeguards regarding security management and security management training, especially regarding the transmission of data. I refer you to, in one of our upcoming webinars will be about the security rule, so we'll go into greater detail at that time about the risk analysis requirement, as well as all of the administrative, technical, and physical safeguards that are required by the security rule. So next up, we'll talk about three parts of the breach notification rule that should be considered for our purposes today for policies and procedures. The first of those is the internal notification policy and procedure. Who do employees tell if they think that your organization had a breach? It's as important for employees to be aware of what constitutes a potential breach and what to be looking out for, as it is to know who they should communicate that potential incident with in order for the next steps to be taken. And then it's also important for employees to know how they're supposed to notify those responsible parties. So if they don't know who they're supposed to tell, and if they don't know how to tell them, you run the risk of an incident going, a potential incident going unreported. The second policy consideration is your incident response. So you have your key elements of analysis to determine whether a breach actually occurred, whether there was a disclosure of PHI, whether that PHI was encrypted or de-identified, whether that PHI was disclosed in the course of services or payment or operations. All of those things need to be detailed to ensure that a proper analysis of an incident is conducted. Again, the next part of it sounds redundant, but this is why it's so important to establish those key elements early. Who conducts and performs the analysis of whether a breach occurred and whether the elements of a breach are met? And then who is responsible for providing the varieties of notice that are required if a breach actually did occur? The third and final policy consideration is your mitigation process. So this is something that the OCR has mentioned. If you create a website or on your own website, post information about a breach, and you communicate to patients and consumers that you're going to keep them updated on the nature of the breach and the way that they can mitigate risk and the way that you will be mitigating risk, it's important to include updating that website and updating that information. And so it's important to make sure that someone's responsible for vetting the information that's posted on that website and for ensuring that the mitigation information that's communicated to consumers is kept up to date. It's also important to have an internal mitigation policy and procedure for directing individuals as to what mitigation steps they can take. So how to know what to communicate to patients when a breach has occurred, what they should do. It may be just the standard, credit bureau notification. It may be some other safeguards that are particular to the nature of the breach. And then third and finally, with respect to the mitigation process, it's important to document the issues that were identified that led to the breach and the corrective actions that were taken in response to the breach, so that you demonstrate your awareness of issues and then controls established in response to those issues. So we have two more topics that we're going to talk about, some policy considerations, and then we'll wrap it up and provide you with an opportunity to ask questions. For business associate management, at a most basic level, it's a requirement that you have a BA agreement with every single business associate, and that's kind of low-hanging fruit. Some of the other issues that can be a little bit more challenging are to ensure that your business associate agreement reflects the current status of your relationship with your business associates or with your covered entities. And so this is where the review of your policies and your documentation comes into play. If you're reviewing your policies and procedures and your business services and your regulatory requirements on at least an annual basis, then you'll be better able to ensure that your BA agreements reflect the current status of your relationship. You also need to have policies and procedures that govern auditing and monitoring of your business associates to make sure that there are clear expectations between the covered entity and the BA regarding what kind of auditing and monitoring is permissible and expected, who bears the costs, what kind of notice is required before an audit occurs, how frequently they will occur. All of the details with respect to an auditing and monitoring relationship between a business associate and a covered entity should be spelled out in your policies and procedures. It's also important to establish defined corrective action policies and procedures for when items and issues are discovered during the auditing and or monitoring process with specificity, with timeframes, with responsible parties, and then in the event that corrective actions either are not sufficient or whether corrective actions aren't properly taken, it's important to document policies and procedures for termination. And that includes the considerations of what kind of event would result in termination of a BA, who at a covered entity would be responsible, or the BA would be responsible for terminating the relationship, what actions would occur with respect to PHI that's held by a business associate upon termination, what kind of notice is required, how that notice should occur, thinking through all the worst case scenarios to ensure that when an unfortunate issue occurs and you're considering termination, that you have defined guidelines that have been communicated between the two parties. So the final HIPAA topic for some important policy and procedure considerations relates to internal auditing. And there are a couple of important considerations that we're going to conclude with that should be considerations when you're designing or reviewing your internal auditing policy. You should have objective internal auditing staff. You can't have the same staff responsible for auditing the process as are responsible for making sure that the process occurs on a regular basis. So you have to have objective audit staff. And if we can move to the next slide, we'll make sure that we get this internal auditing procedure and policies, make sure they're clear. So it's important to make sure you have objective staff. And then there are 4 things that the OCR recommends when trying to establish an internal auditing procedure. And this is one of those areas where entities tend to struggle to get off the ground. And so if you start with these 4 items, it creates a sufficient baseline to move forward. The first is to identify risks. And if you've conducted a risk assessment or you've had a third party conduct a risk assessment for you, then you have a starting place for your internal auditing procedure. The second is to conduct a baseline assessment. Now, just depending on the sophistication of your staff and your resources, you might be able to do more than just a baseline assessment. But at the very least, it's important to conduct a baseline assessment of those risks and your compliance with certain requirements. And then the third step is to develop a plan for ongoing auditing. So now that you've identified risks and you've conducted a baseline assessment, it's important to establish a defined plan of the frequency and the scope of your auditing program. And that's something, as we've mentioned, with other policies and procedures that requires an ongoing evaluation. As your business changes and develops, as your business associate or your covered entities change and develop, as regulations change, your need for ongoing auditing is likely to change as well. And then the fourth and final element is to have defined processes and policies around corrective action plans. This is something that's important not only for your business associates if you're a covered entity, but it's something that's important for an internal auditing program. It's important to identify the risks and to identify noncompliance and make sure your staff is objective and make sure you have a defined, organized, sufficient plan. But it's also important to ensure that once you've conducted your internal audits, that you have a path for moving forward to make sure that issues identified during those internal audits are sufficiently addressed. So to kind of wrap things up, when you're talking about policies and procedures, it's important to know the why. The law says it, but policies and procedures also establish brevity and clarity and uniformity. It's important to understand the keys to policies and procedures, the key concepts like authority and creation and review and communication, and then the key elements, starting from your purpose, working all the way down to your references section. And then finally, learn from others' mistakes. The need to review policies and procedures is constant, and others' mistakes, including enforcement actions that are published by the OCR, are a useful tool in seeing areas of potential weakness and seeing how the OCR has interpreted the requirements for policies and procedures and for making sure that you attempt to mitigate the risk from the very same thing occurring to you. So I appreciate your time and attention, and at this point we'll turn it over to if there are any questions.
Thank you, Mark. We appreciate the presentation today and the good advice on policies and procedures. One of the questions we always get is, will there be a recording of this webinar? Everyone who registered for the webinar will receive a link to the recording. It usually takes a couple of days, and the same is true for your certificate of attendance for your continuing education credits. You will receive that by email within the next couple of days. Okay, so we'll get to a few questions here, Mark, and the first one is, how long should we keep past documentation such as policy history, notices, BA agreements, et cetera?
That's a good question. So it depends on the nature of the records involved and the nature of the specific instances to those. So, you know, some of your templates, like your notice of privacy practices, you want to keep around. You can consider regulatory changes and business changes as kind of guidelines for how long you should keep those records. And if you're talking about like business associate agreements, if there was a termination of a business associate, you would want to consider keeping those records longer than if a termination for some kind of issue, as opposed to just moving on to a different business associate. There's going to be different lengths of time depending on the nature of those records and the reason that you've updated or improved those records.
Okay, thank you. And if you do have a question, by the way, go ahead and put that into the Q&A field in the WebEx interface, and we will get to that. Is there a risk of having, is there a greater risk of having no policy versus having a policy that is incorrect in some fashion?
I'd say it's a much greater risk to have no policy at all. The idea that we can have perfect policies and procedures is something that every compliance professional aspires to, but we know deep down is not possible. But the process of establishing requirements and policies and procedures is just as much an important part of compliance as the actual document itself. If you're reviewing policies and procedures every year, then you're likely having discussions about whether things are working, whether there are changes in the industry, whether there have been enforcement actions. So even an incorrect policy seems to me to serve as a source of awareness and guidelines, and no policy at all, I think would just leave you open to the wild, wild west.
Is it proper for someone with operational responsibilities to create the first version of a policy?
I think a person with operational knowledge can be very helpful. If I don't see an issue with them creating it. It's important, I think, in general, when you're creating policies and procedures, to make sure, like I said, that you have considerations about ensuring that the document covers legal requirements and it doesn't conflict with other internal documents. So that may be a part that a person with operational experience might not be as aware of. But in terms of creating a procedure, that's somewhere where a person with operational experience might provide a lot of value.
Okay, thank you. And we will end on this one today. Mark, do you have any good resources to provide examples or starting place on the policies that are necessary to have in place?
Well, that's a good question. I'm reluctant to provide recommendations beyond services that Kirkpatrick Price might provide, not just for self-serving purposes, but because, you know, being concerned about the quality and the sufficiency of those documents, as well as, yeah, just not being familiar with them. So, I welcome you to talk with us. And again, if there were good resources that I had vetted and I felt comfortable sharing, I'd be happy to do so. But I think it's important to do a lot of analysis when you're buying an out-of-the-box kind of policy to make sure that you're putting the thought into it to make sure it's appropriate, beyond just making sure the names and the addresses and those kinds of things are filled in right.
Okay, well, I want to take this opportunity to tell everyone about next month's topic, which is on the privacy rule. And you'll see on the screen right now, January through November, the schedule, and again, the ones that have happened in the past. You're free to visit kirkpatrickprice.com in order to download recordings of any of these prior webinars. But in May, we will cover the privacy rule, dealing with privacy notices, and we also have some additional resources here for you to help answer that one question that came about help with drafting policies and procedures. So when you do get this this copy of the presentation, you'll be able to click on those and it'll take you directly to our website where you can access these resources. But our webinar in May, I believe, is scheduled for May the 25th at 12 o'clock Central Standard Time. So you will receive an invitation to that, and we would like to ask you to share the invitation with anyone else that you think would be interested in the series and could benefit from it. We want to get the word out there and get as many people to sign up for the Road to HIPAA Compliance as possible. Again, we want to thank Mark Heinle for participating with us today and giving us this valuable information. If you do have any questions after this presentation, feel free to email Mark directly. His address is mark.heinle@hhs.gov. Thank you again for joining us today, and we look forward to seeing you next time.